Therapy. This is Adam with Elite Sport and Spine, and welcome to the last piece of our video series of PT versus chiropractor. Getting into some more nitty-gritty today, so it should be all good. So first of all, just to learn a little bit more about us, Adam, what's your favorite thing to treat?
Shoulders. I
Okay.
think with my volleyball background, I know a lot of guys and ladies that have shoulder pain, and it could limit their ability to play. And I think treating people with shoulder pain, shoulder dysfunction, I think that's my favorite one. It's a complex joint. You have to get pretty specific with it, but it can be pretty dynamic in the change that can happen pretty quickly.
Yeah. So what are some kind of like shoulder injuries that you see?
You know, the common like rotator cuff tendinopathy, or a lot of times it usually has to do with just having control of your scapula in various positions. So building your ability to control your shoulder blade throughout the entire arc of motion that your shoulder has to have is an important component. And usually that's just it could be due to some sort of myofascial restriction or some sort of trigger point or whatever, but more commonly it's due to some sort of weakness in certain muscles that aren't doing their job properly. So making sure you're figuring out which one, what exercise to prescribe, and if they're doing it.
Yeah, definitely. Yeah, you gotta follow through, do your homework, people. So,
What about you?
Yeah, so my favorite actually is the hip, which means the shoulder of the lower body.
Yeah.
You know, we're both talking about these like ball and socket joints. I think hips are super interesting because there's so much connected there. You know, I see a lot of people who come into my office with back pain, and it's not really their back, it's their hips that are super locked up, and now their back is taking the brunt of it. Or they're coming in with knee pain, it's like your knees are super healthy, but your hips are, you know, they're either weak or they're either stiff, something like that. And then once you can like unlock someone's hips, it's amazing how much better they can move. And it's just a big, gritty joint.
It's a big joint.
So it's fun, like just being able to like kind of get in there and just work it out, because you know, working on your own hip. If any of you have ever tried like, you know, shoving like a cross ball or your butt cheek and all that stuff, like, you know, it's just fun being able to like really just kind of like manhandle and work on that stuff. So
Yeah, the hip is good. The hip is tough. It's a tough one. A lot of stuff going on down there.
Oh man, totally. Like luckily I don't have a scapula down there to deal with, so that's one benefit, I guess. All right. So now one of the questions, and I get this a lot from my patients too, is that like, what's the deal with PTs and chiropractors? Like, you know, do you guys get along? Do you not? Like, why do the professions oftentimes clash? So what do you think, Adam?
So I've looked at, there's 7.53 billion people in the world. So if we take all those people as one piece of the pie, or a pie, then you have a small wedge of that pie that is going to be the individuals who are going to seek conservative care for their aches and pains. So, and then you have PTs and chiros that are fighting for that small wedge of the pie, and they feel like it's a competition to get as many pieces of that little wedge of the pie. Versus educating individuals about the benefits of conservative measures and widening out that piece of the pie to make more of the whole pie, and then there's more to grab at. So I think that's a little bit, it's an arms race to get the people, to get the patients. And I think, I can only speak from my side, and chiropractic as a whole in general has not done a very good job with research as far as what it is that we do, backing up our validity with what we've been saying for so many years. So that's a little bit of it too. There are a lot of individuals out there making claims that we don't have a lot of scientific data to back. And I think that just kind of butts heads with other like-minded professionals. And I personally believe that if we want to get better at working with other healthcare providers, medical doctors, and orthopedic surgeons and all that kind of stuff, we have to get better research out there, what it is that we're actually doing, and then actually publish it and get it out to people so that they can read like what are the benefits of spinal manipulation paired with exercise, paired with manual therapy, that kind of stuff. So I think it really has to do with that small little wedge of the pie that we're all trying to get a piece at. So versus making it a bigger piece.
Yeah, I totally agree. Like, you know, there's you know, when you look at you know, that large pie, you know, there really is only a small portion of the population that is actively seeking care. But when we can work together to help people understand that like you can see PTs and chiropractors for like maintenance, for example, like to keep you feeling good, like almost like you go to your dentist twice a year to get your teeth checked, like see a PT or a chiropractor to make sure that you're still moving as well as you can,
especially if you're very active.
Yes.
Yeah.
Right. Or like if you're very active and you have a sedentary job, like that, like mix of the two is kind of a perfect storm for like stuff to happen in between. So if we can make sure that you're moving your best, that's huge. And I think on the PT side of it, like we have a lot of research that's been published, but it's still only a very small percentage that backs up the types of treatment that we have. I think in PT too, we have a bit of an identity crisis. Like, if you know 3 people who are physical therapists, or if you've been to PT for 3 different things, you've had completely different treatments every single time. So there's no standardization within the practice. The like regulations and all the letters behind our names, like no one knows what like any of that stuff stands for unless you're actually like in the profession. And the thing is, like between what we do, there's a lot of overlap.
There is a lot of overlap. And then the other thing is there are differences between like what I as a chiropractor can do in the state of Wisconsin versus what she as a physical therapist can do, which is why we can work well together, because I can't do certain things that patients could benefit from, and that's when I would go, hey, I have a physical therapist that I can send you to that can do dry needling, for example, which I can't. So that's kind of how we can collaboratively work in the future.
Yeah. Or like, when I send my patients over to see a chiropractor, usually it's because there's something that I can't get to move the way that I want it to, or the way that you want it to. Like, for example, like ribs.
Sure.
Oh, ribs. I hate treating ribs. I'm going to be completely honest. Because, how one moves affect how the ones above and below move it, and it's just complex. And to be completely honest, chiropractors have much more detailed training in some of those, more specific movement mechanics. And so if I can't get something to move the way that I want it to, I'm going to send the patient to a chiropractor. Or sometimes too, I can be difficult to get into, and if I know that Adam's just around the corner and he might have some availability tomorrow, let's send you over there. You're going to get great treatment no matter where you go, and let's get on top of it and let's treat it. So
cool.
Yeah, awesome. And then I guess you mentioned research, and that's definitely a need for the future. Where do you see chiropractic otherwise, like going, let's say, in the next decade or so?
I think with any sort of conservative care, I think it's going to be some sort of collaborative, integrative healthcare, whether it be in a hospital setting or something where, because back pain is the most common disability in the world, so rather than prescribing opioids or some sort of other drug, let's get you on board with conservative care. Let's do that trial run. So working closely with medical professionals and managing people with back pain, that kind of stuff. I think that's where a lot of the research is going to get, like the money's going to get pumped into, because that's what most people are dealing with, so why not try to support it with evidence? But I think that's going to be the future. There's going to be some sort of collaboration with other healthcare professionals.
Yeah, I definitely agree. I mean, PTs, we've been kind of like in the more traditional medical system for a while, but I think on our end, not only is there an increase in this awareness of the effectiveness of conservative care, and that like reallocation of funding from these like large, pharmaceutical companies, we're finding that conservative measures tend to be they're better outcomes. And like I don't even like the word like conservative care, because I think like going directly and working on someone's back and someone's problem, I would consider that aggressive care. We're getting right to the specific issue rather than like covering it up with some sort of medication. So, and I think on PT end of it, I see my profession, especially like kind of in the outpatient orthopedic world, getting a little bit more like boots on the ground, like being more like accessible to people. We have now in all 50 states, we have direct access. So you can come and see a physical therapist without having to see your doctor first. And like chiropractors have had this for forever.
Forever, yeah.
So, now we're much more available, and that's why I'm here at a CrossFit gym.
Yep.
I want to go to where, the people are, where are you working out?
Yeah.
Let's, treat you here and use the equipment that you're using to work out so that we can replicate the things that you're having issues with, or, overload you so that, if you're having issues, let's say picking your grandkid up off the floor, I have racks and weights and barbells and dumbbells and all of that stuff, so we can not only replicate the 30-pound toddler that you're picking up, but now let's make it 80 pounds.
Yeah.
Let's make it so that 30-pound toddler is no problem, let's throw him over your shoulder and let's go.
Yeah. Yeah.
So I think that's definitely a direction that
the availability is definitely nice, for sure.
Yeah. So ultimately that's why we got into this in the first place, right? If we circle back to it, we got into it because we want to help people and be as available as possible.
Definitely.
So, all right. Well, Adam, thank you so much for this video series. This
No
was
problem.
awesome.
Hope you guys learned some stuff.
Yes, absolutely. And if you have any questions, feel free to either contact either one of us. We are more than happy to help out in any way we can.
All right. Have a great day.
All right. Thanks, guys.